So that was basically, we've covered the Australia's health system. So we've covered the first couple of dot points. Now we're moving on to this idea of health promotion and initiatives. So the first dot point says that you need to pick one of the health issues in Australia and then pick an initiative that addresses one of these issues. So, like, you can pick either road safety, skin cancer, smoking, and for this lecture, I've picked smoking. Okay, so the first thing you need to know is why smoking is targeted, or why is skin cancer targeted, why is road safety targeted. It's basically like statistics. So one reason is that smoking kills around 15,000 Australians each year, and it affects vulnerable population groups disproportionately, and affects, like these vulnerable population groups. And in terms of the effectiveness of health promotion, there has been a delay in the uptake of smoking, right? So basically from like the 80s onwards, there's been huge campaigns to ensure that smoking rates are reduced. And it's been effective. There are less people smoking now. Fewer people are being exposed to secondhand tobacco smoke. So it decreased from, in 1995, 31% of children were exposed to it, whereas in 2013, only 3.7%. And if you didn't know, secondhand tobacco smoke is when when someone else is smoking and then you breathe it in. Okay? The prevalence of daily smokers aged over 12 has decreased from 24% to 12%. This is really significant. It means that these health promotion campaigns are actually effective, right? Even though it might seem like kind of silly, like how can ads and things like that actually change? But what we don't realize is media has a huge impact on how we make our decisions and everything. So the government has been using it to its advantage to ensure that health promotion is achieved and rates of smoking are decreased so that life expectancy increases. Alrighty. Now, you need to know one specific health promotion program that is used to address this specific health issue. So I picked Quitline. That's basically a telephone service that people can access for strategies on how to quit. And it's staffed by highly trained specialists, and there is an Aboriginal Quitline available for Indigenous people. The Quitline provides callers with a personalised plan to quit, so it's really individualised because it's just one-on-one. And it's only the cost of a phone call, or if you're referred to by a health professional, it's completely free. So not only that, it's available to all Australians, regardless of your socioeconomic status, right? So it's really accessible. It's really ensuring that the personal skills are developed in terms of knowing how to quit, knowing where to access information, knowing how to access support groups on how to quit from highly trained specialists. And it's ensuring that there's huge focus on preventing smoking instead of treating diseases caused by smoking. Okay? So yeah, quit Victoria. So you need to ensure that you actually can explain how this program reflects the Ottawa Charter for Health Promotion action areas. Okay? So if you remember the acronym, it is Boys Can Swim Down Rivers, or Bad Cats Smell Dead Rats. Okay, so build healthy public policy for B. It has pushed for smoke-free outdoor areas so that there's more regulations limiting smoking. For C, create supportive environments. There's Quitline, Quit Coach, and Quit Text. And they're all online platforms to assist smokers to quit, right? And the fact that there are a range of online platforms for this ensures that there is really low levels of there's really low levels of resistance in terms of quitting smoking. It's really easy, less friction. Strengthens community action. There are online resources available specifically for friends and families of smokers. So it's not just it's not the onus of just the smoker. Friends and family can also assist the smoker to quit. So they're all working towards one common shared health goal. Develop personal skills. So when you're providing practical advice and strategies on quitting, you're actually giving them personal skills to make decisions about their own health to improve their health and well-being, right? And it also reorients health services. A specialist training is provided to health professionals so that they can undertake interventions and referrals to Quitline, right? So if they see one of their patients is like really struggling to quit and they want to also quit, they can actually refer them to Quitline, right? The doctors can. So they're taking on this role of the educator, and yeah, ensuring that there's less resistance to quitting as health professionals are also being involved in quitting. Alrighty, time for another practice question. So VCA 2019. So you're selecting a target area, so it's a health issue for health promotion. Okay, so I probably would pick smoking because that's the one we've covered. And then you say, explain why health promotion was used to target this area. Alright, so when you're saying that, basically what we're saying is, hey, smoking actually led to many of these communicable and non-communicable diseases due to weakened immune function. It killed 15,000 smokers per year. So you're using data and you're saying, hey, smoking has been shown to cause this disease, right? So you're saying why smoking was really harming our population. That is why it's targeted. Same thing for skin cancer and same thing for road safety. You would say there were this many deaths happening on the roads each year, or this many people were dying from skin cancer. So yeah. So in this answer, what they said is skin cancer. And they said Australia has the highest rate of skin cancer in the world. Many cases of skin cancer are preventable by changing behavior such as the use of sunscreen. Right, so they didn't have any data or anything, any complex data that they had to memorize. They just said this is the reason. Australia has the highest rate, right? So no numbers, and many cases are preventable. Okay, same with smoking. Many smoking-related illnesses are preventable. So you could also use that to explain why health promotion was used to target this area.